Oh, it's on and going. Just people always say the same thing when it goes live.
Just what?
When it goes live. Hey. So it says we are live. It appears that we are. Hello, everyone.
Oh, Jonathan's on.
Dr. Sarah in the house. Avi, we're on her Instagram.
So we are going to be doing some Botox.
There she is.
It's Botox or Dysport.
Yep. Hi,
Ashleigh.
Cammie.
People ask me all the time, what's the difference between Botox and Dysport? They're both botulinum toxin, and they both work in the same way. Botox is a larger molecule. Dysport's a smaller molecule. Dysport starts working a little bit faster, but they both reach peak effect at 2 weeks. Dysport starts to work after 1 day to 2 days, where Dysport takes about 4 to 5 days to start to work. They both peak at 2 weeks, and they both last the same 3 to 4 months. Some people say it lasts 6 months, but...
We got a question here that says, you in the chair today, Ashleigh. That's right, my favorite chair to be in. This one says...
Ashley's crying about the wrinkles in her forehead, so here we are.
For real.
Injecting them.
It says, the question is, do you use Botox yourself?
Me?
Yeah.
Yeah.
Do we breathe
Actually, I personally prefer Dysport. Don't tell anybody that. But I personally prefer Dysport. And Ashleigh, what about you? I think you prefer that too, right?
Dysport, for sure. Team Dysport over here.
Some fresh Dysport mixed up.
Yep. So yes, we use Botox. Does a fish swim in the water?
So to give people a little anatomy lesson, I'm going to get
this is one of my favorite charts that we have here. Send us your questions, guys.
So, wait, no, you can say normal.
Okay.
We'll just go like this. Pretend this is Ashleigh. Okay. So, these muscles, the frontalis muscles, I know there's some glare from the thing, are these two muscles here. So, lift your forehead, your eyebrows up. So, these horizontal lines are caused by these frontalis muscles. So, you see one kind of goes here, one goes here. Some people, it connects in the center, and some it separates. So when you lift up, if you only get Botox here and here, sometimes there's a weird wrinkle in the center that remains. Some people remember that from the Oscars. Reese Witherspoon had that right here. And so you always want to make sure that a little squirt gets injected there just in case. And don't ignore the middle. But some people do ignore the middle. But this is the frontalis muscles. It's for the horizontal lines on the forehead. Things to keep in mind that if you're male, it will lower. Oh, I think you can just move the thing in the middle. No, where the phone is. Yeah. So
sorry, guys.
Go like that.
Right.
Okay.
And what do I do for the light? What
it's the center button that has like the.
Oh, there we go. Sorry.
Okay.
Hi, Jeanette.
So what was it saying?
Reese Witherspoon.
Yeah,
and then the frontalis muscles, the center.
Yeah, I know. Whoops. So anyway, the horizontal lines.
Oh yeah.
Wait, now I remember. Okay, so when you do block these out, the elevators of the eyebrow, it can make the eyebrows sit a little bit lower. So some people that are already heavy on the eyebrows,
for males,
yes, super heavy in the eyebrows. If you block the frontalis muscles, it will make the eyebrows go down a little bit, so you just have to be careful.
Thank you guys for reminding us what we were talking about. So studious. Everyone's listening.
Right. And so that's one common area people get Botox. Another common area is in what's called the glabella. That's for these 11s. Can you make that bitch face?
I'm trying.
Come on, you do a good job of it.
I know.
No, but you can see she doesn't have that much movement.
Yeah.
But some people have very strong 11s or a 1 right in the center. And if you let that go too long, then you can end up having such a crease that you need filler put in there. So we're trying to avoid that. But if you look here, so there's 3 muscles. Hold on, let me go in front of Ashleigh. So you have your procerus here and your 2 corrugators. So alongside of the procerus, between the procerus and the 2 corrugators, you'll get one of the 11s and the other one in the center. So that's typically why people will get this area injected here. Full dose is 20 units. Some people want less or can get away with less, but typically it's 20 units. And then the crow's feet here are caused by this sphincter muscle. You can see it right there. So we're going to be injecting here. If we inject up in this upper portion right here, it allows a little bit of elevation to the side of the eyebrow. So some people that are very heavy and they want a little bit of raise, like a teeny bit of raise here. If we block from right here around to here, then it can give a little elevation of the side. So we're going to be doing that.
That's what I do like.
Some people really like the chin area because they get dimpling of the chin. And then, you know, it gets puckering and permanent dimples. Some people like it in their masseter muscles if they grind or have bruxism.
I'm going to sit up so they can see my full face.
Above the upper lip or underneath the lower lip, close to the lip line, is where people will get it for a lip flip. So for people that want more show of the pink part of their lips but don't necessarily want to get fillers, that's a great way, a great thing to inject is right here, or for people who have a gummy smile. So, you know, one is to inject right here, but then it will really drop the whole lip or really close to the lip line. And then that will allow, you know, a little bit of drop of the lip. And so it helps with a gummy smile.
I got my first lip flip not that long ago. And if anyone is considering it, obviously you should discuss it with Dr. Sarah if it's the right treatment for you. But what I will tell you is I love it. And I really like what it did for my, like, the rounding out of the pink of my lip. And yeah, so I just wanted to share that with you guys. So if you have questions about Botox, filler, lasers, IPL, skin treatment, skincare, you know, we'll just be hanging out here while she does my Botox.
I should have gone live for I did microneedling with PRP today.
Oh.
It's always interesting to watch.
Yeah.
Wasn't too much of a bloodbath today, but
oh, that's good. That is always good. Because you saw a lot of patients today. Lots of Botox, lots of fillers. You know, people are lasers, all kinds of things.
Yeah, I made posts of them, but I didn't do any lives during that.
Yeah.
So we're going to get started, and we're going to do a little bit of.
See, this is what we cannot have.
Who said that?
Me. It was just my eyebrows.
No. Did you tell them that you tried your best not to even have any facial expression?
Yes. Yes. Yes.
Okay, so before who's ever injecting you, here, you want me to bring this up a little bit so they can see?
Sure. Yes.
Let's see if you guys can see a little bit better. Maybe we can move. Whoa! In front of Ashleigh. Okay, can you guys see a little bit better? I'm going to bring you up a little bit more. Hold on, let me move that. Let me move this too.
It is.
Okay, so.
Oh, wow.
Is that better?
Oh, that's perfect.
Yeah. We had Shorty in the seat before.
We had a shorty in the seat.
Mm-hmm. Okay. So it's very important to try not to have any makeup on. Ashleigh doesn't wear a lot of makeup, as you can see here, because nothing's coming really.
Who needs makeup when you have YovinoMD?
That's right. So, you know, you can see how clean your skin.
Wow, just concealer underneath my eyes. Also, I think it would be a great time to mention tonight that if you're on Clubhouse at 7:30 p.m., you should follow Dr. Justin and Dr. Sarah. They're going to be doing a really exciting talk about celebrities and filler and skincare, awake procedures. Dr. Sarah's painless lip aug will be covering it all. Sorry.
Okay, I'm going to turn you to the right so they can just see. So she likes a little elevation, so I'm going to be injecting right here. I'll put my finger along her ridge so I can see where I'm at. So the muscle's very, very superficial. So I'm sticking into the very superficial plane here. Just like that.
Such a gentle touch Dr. Sarah has. No numbing. She just is very gentle.
Okay, we'll turn you this.
She's like, that's what you think?
So If you put her ridge is right here, so we're going right in here. This is for the little bit of that elevation. And you can see that in some cases, you can see it's very vascular in this area. So it's important to kind of see where you're at, stretch out the tissue.
Okay. Bye, Dr. Justin.
Then, where are you going? He left me?
He left.
Did you just say he's going?
I don't know if he said he's going home or going to get the car.
Oh. Okay, so that's orbicularis muscle. We'll look back here and this is the procerus for the, close your eyes super tight. Is that as much as you can do? You're not really moving. But you see how it pulls down? That's from this single procerus muscle. You can relax. So we're just gonna inject that. And then the two corrugators that bring the eyebrows this way. Medial. So it's simple. I use a very tiny gauge needle to do this.
Last time I had any Botox was
last week? No, I'm kidding. No, I'm just kidding.
November 18th.
Mm.
Yeah.
Okay, so lift your eyebrows up. So you see she has a pull like this, but she also has a little bit here, but she pulls like that. And so if I come all the way over here and lift up, you're still going to see elevation here, and she's going to hate that. It's what they call the Spock eyebrow.
Sorry, guys, we're back.
Sorry, my son was calling. Okay, so I'm going to come out here a little bit further so she can get a little bit of, we're not getting Spock eyebrows. Just kind of sprinkling it over.
Sprinkling it on.
Sprinkling it on.
Nothing I'd rather be doing on Friday than this, to be honest with
You better not go home and work out.
No, I won't.
So things to consider.
Let's talk about that.
Is that you should not work out immediately after getting Botox because you'll sweat out the toxin. You want the toxin to go to that neuromuscular junction and really block the nerve, the pulses. If you work out right away, then you can potentially sweat out a lot of the toxin.
Yep.
So you really don't want to do that. Okay, so I'm over here.
Love it, says Jose. Jose, we miss you.
Yeah, we miss you, Jose. Okay. Have you been, so Jose does this circle of positivity.
Ooh.
It's great. It's so nice. Okay, lift up. Okay, so you kind of pull in a little right here. We do a little extra squirt. A little extra squirt here. Look.
Oh, he misses us too.
Lift up again on that side. Okay, relax. I'll do one last one on this side. Just turn this way. I lied, one more.
Sprinkle all you want.
That's it.
Yay. And so I won't work out tonight.
Mm-hmm. You're not going to sleep on your face.
I won't sleep on my face.
If she needs a massage or do anything, she's going to massage upward, not down towards her eyes. Just kind of how I'm rubbing like upward. That's what she'll want to do.
And then I'll likely go home and put a little bit of the erase paste on from YovinoMD, just because it has arnica and things like that. So I like to use that after any time I get any sort of injection.
Yeah, I don't think you're going to bruise. I don't think you're going to bruise, but...
Thank you for watching our live. Just love this live.
So yeah, so that was pretty much that was actually Dysport, but that's the whole treatment kind of in a nutshell.
Yep.
Does anybody have any questions while we sit here before we sign off?
Go ahead and send them our way.
So this was Dysport. This wasn't Botox. So this will start to kick in tomorrow. So if you have an event and you're like, oh my God, I forgot to get, my toxin, or you're like, I'm wrinkling and I want to look good, then choose Dysport over Botox because it will kick in faster. But it's best to always plan ahead because you could bruise with the treatment. ways to avoid bruising is to pre-ice the face.
Mm-hmm.
So we do have little ice packs. You want ice, Cindy? Do you want ice? Do you feel like you need it?
I think I'm okay.
Okay. So we do have ice packs. You can ice it. It causes vasoconstriction. So anytime you have, shrinking of your vessels, less prone to bruising. I know it's the weekend.
I'm not going to be drinking.
Okay. Why'd you gotta say that?
So I know where this is going.
Dysport and Botox are the same price for the person who has to eat.
Mm-hmm.
But alcohol can thin out your blood. It will make your platelets not work as well, just like aspirin or Motrin. Or it just makes your vessels a little leakier. So if you drink and if you work out and all this, you're bending over and doing a lot of physical labor over the weekend, you could bruise.
Mm-hmm.
She walk out of here, looking good, and then she goes and does something, and then all of a sudden, ends up with a bruise. It's going to start kicking in tomorrow for her, and then it will reach peak effect at 2 weeks. So in 2 weeks' time, if there's any irregularity, and remember, sometimes the muscles don't necessarily all quiet down at the same time. She might feel that one side, looks smooth and the other side's still moving. Don't panic until about 2 weeks down the line, because typically some muscles are take a little bit longer to kick in. Both Botox and Dysport last the same amount of time. They both last approximately 3 to 4 months, depending on your metabolism. Some people who work out, you work out every day, right?
Close to it.
And how long do you think it lasts in you?
I think I'm at 4 months. I'm just around 4 months.
That's good.
Yeah.
Men typically need more units than women because their muscles are stronger. And so in a female who normally in the glabella might be 20 units, a man may maybe 30 units, something like that.
Mm-hmm.
Just keep that in mind.
Yeah.
And let's see what else.
You want to share a little bit more about what you're going to be talking about on Clubhouse tonight at 7:30 p.m.?
So it will be our first time on Clubhouse.
Ooh, so exciting.
We are Clubhouse virgins. But it will be the first time that we are in a room.
So excited.
And we are going to be talking about, what's the name of that girl on The Bachelor?
Oh, I know who you're talking about.
There was someone who was on The Bachelor. She was actually engaged to Ari, and then they broke off and she just got married. But she has, she just admitted that she has had work done since her time on The Bachelor. So it was, Us Weekly came out with an article. So we're going to be touching upon that. And we are going to be talking about awake surgery, all things awake, and what that means and how you get it and how we really achieve a comfortable status of the patient and they can tolerate being fully awake, not under general anesthesia. We're going to talk about maybe skincare. It's kind of open to discussion.
Yep, that's what's really cool about Clubhouse. So 7:30. It's Dr. Just like her, it's the same Instagram handle, but it's on Clubhouse.
And Dr. Justin.
And Dr. Justin as well.
And
same
Kim
thing.
Bujek.
Awesome.
And
Kiara?
And Kiara Aguilan.
Yep. So we are so excited for that. Tammy says, you are the injection queen.
That's
yes,
right, Tammy.
she is. Yes, she is. So for all of our patients, if we haven't seen you in a while, come in and see us. We would love to see you. I know you're probably jealous that I'm sitting in this chair and it's not you, but it can be you too. I know.
Look at this crap over here.
I love it.
But can't inject myself.
Yeah.
And Dr. Justin already left the building, so I'm here on my own again.
Yep. He had 2 surgeries today. He's heading straight home to probably watch golf or something.
He's already crying.
Yeah.
He for sure is running home to watch golf.
Yeah. Oh, thanks.
All right.
Thanks, you guys, for watching.
So we'll see you guys a little later. Thank you.